Today, we're going to talk about Kapvay. Kapvay is used alone or with other medications to treat attention deficit hyperactivity disorder, ADHD, as part of a total treatment plan, including psychological, social, and other treatments. It helps to improve your ability to pay attention, stay focused on an activity, and control behavior problems. Kapvay is usually taken 2 times a day, with or without food. Your doctor will determine the best dosage for you based on your medical condition and response to treatment. It's important to take Kapvay at the same times each day to get the most benefit. Remember to follow your doctor's instructions carefully and never adjust your dosage without consulting your doctor first. When taking Kapvay, it is important to follow the instructions provided by your doctor or pharmacist. Usually, it is taken twice daily, in the morning and at bedtime. If the doses are not equal, take the larger dose at bedtime. To reduce the risk of side effects, your doctor may start you on a low dose and gradually increase it. It's important to swallow the tablets whole and not crush or chew them. The dosage will be based on your medical condition and response to treatment. Take Kapvay regularly at the same times each day to get the most benefit from it. Even if you start feeling better, do not stop taking the medication without consulting your doctor. Stopping the medication suddenly can lead to symptoms such as headache, fast heartbeat, nausea, anxiety, flushing, or a rapid rise in blood pressure. Your doctor may need to gradually reduce your dose when stopping the medication to prevent any adverse reactions. It is also important to not switch between different forms of clonidine medication without your doctor's permission and not to take other clonidine-containing products while taking Kapvay. If your condition does not improve or worsens, be sure to inform your doctor. Some common side effects of Kapvay include dizziness, lightheadedness, drowsiness, tiredness, stuffy nose, dry mouth, or constipation. If any of these effects persist or worsen, notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, rise slowly when getting up from a sitting or lying position. To relieve dry mouth, you can try sucking on sugarless, hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. Remember, this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. Inform your doctor immediately if you experience serious side effects such as fainting, slow/irregular heartbeat, or changes in mental/mood, such as irritability or depression. While a very serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching/swelling of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you experience other effects not listed here, contact your doctor or pharmacist. If you experience any side effects, you can report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Kapvay, it's important to let your doctor or pharmacist know if you have any allergies or if you've had any allergic reactions to clonidine in the past. This medication may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have any heart rhythm problems, low blood pressure, or kidney disease. Kapvay may cause dizziness or drowsiness, and using alcohol or marijuana can increase these effects. It's important to avoid driving or using machinery until you know how this medication affects you. It's also important to let your doctor know if you are using marijuana. If you wear contact lenses, you may need to use wetting eye drops as Kapvay can cause dry eyes. Older adults may be more sensitive to the side effects of this medication, which can increase the risk of falling. If you are pregnant, it's important to discuss the risks and benefits of using Kapvay with your doctor. This medication can pass into breast milk and may have negative effects on a nursing infant, so it's important to consult your doctor before breastfeeding. When taking Kapvay, it's important to be aware of potential drug interactions. This means that other medications or substances you are taking could affect how Kapvay works or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs, as well as herbal products. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. If you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, drugs for sleep or anxiety, muscle relaxants, or opioid pain relievers, be sure to inform your doctor or pharmacist. Also, check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Ask your pharmacist about using those products safely. Additionally, some products may contain ingredients that could raise your blood pressure. Make sure to inform your pharmacist about all the products you are using, and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. It's important to communicate openly with your healthcare providers about all the medications and products you are using to ensure your safety and well-being. If you or someone else has taken too much Kapvay and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the Poison Control Center at 1-800-222-1222. In Canada, reach out to a provincial poison control center. Signs of an overdose can include extreme dizziness or drowsiness, fainting, a slow or irregular heartbeat, shallow breathing, or seizures. It is important not to share Kapvay with others. While taking this medication, it is important to have regular lab and/or medical tests to monitor your blood pressure and heart rate. Make sure to keep all of your medical and lab appointments. It's best to consult your doctor for more details on the frequency of these appointments. If you forget to take a dose, just wait until your next scheduled dose. Don't take extra to make up for the missed dose. If you happen to miss 2 or more doses in a row, it's important to get in touch with your doctor as soon as possible. When it comes to storing Kapvay, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a safe place that's out of reach of children and pets. When it comes to getting rid of any leftover or expired medication, it's important to do so properly. Instead of flushing it down the toilet or pouring it into a drain, it's best to consult with your pharmacist or local waste disposal company to find the best way to discard it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.